bit about how it's different and how your typical day plays out and how that might be different from a resident who's not doing a subspecialty?
Sure. So our residency, from our knowledge, as of right now, is the only one who offers an LGBTQ subspecialty track. So we're the only ones who get specific training in that. Now, what that means, mainly the biggest difference is that we have a continuity clinic that's at the gender medicine clinic. So one clinic a week when we're on our outpatient rotations, we are over there seeing our own patient panel, and we only care for transgender patients there. So as far as the volume that you're exposed to and the different like research and environment, that is very different at the continuity clinic. I'd say from day to day, there's not a whole lot of difference. We tend to see more LGBTQ patients at the family medicine center. Just in general, once your name gets out into the community, people kind of word of mouth will find you. But other than that, I'd say the day to day isn't super different.
Yeah, I was going to focus on, that we do have this continuity clinic, but I think our clinics have shifted, our clinics at the Family Medicine Center have shifted to be a little bit more patients in the LGBTQ plus community. So I think our panels are a little bit different than the average patient panel here. And I think one thing that we've become more comfortable with that's kind of unique is that we're also providing primary care at the gender wellness clinic at Eskenazi. So we kind of learn the interface between what the issues are with the transgender community in terms of things that we need to provide for access to healthcare, mental health, as well as general primary care things that the community may or may not be at increased risk for, and kind of learning how to screen if we're putting someone on hormones, screen for different things. So we've kind of integrated this specialty training into a primary care practice as well, which I think has really helped me at least to kind of feel like I'm more comfortable moving forward with providing care for the patients in the future that I'm going to see when I graduate.
Yeah, another thing that when he was talking that made me think of, we not only learn a lot, we kind of took on this role, whether we liked it or not at the beginning, as teacher for everybody else at the Family Medicine Center. So it was really common as soon as we got enrolled in the track and then started having some education, then a lot of residents, I would say, come to us quite frequently for questions, not about just like gender medicine, but also because we do a lot of HIV, STD care as well as PrEP. PrEP is a big one we get a lot of questions about. We've kind of become the go-to people for most of the residents when they have questions. And then even with some of the newer updates, sometimes like staff will ask like questions and what we're doing now and kind of what we're thinking of. So I think from that standpoint, it's been good because I know, both really interested in continuing to do some teaching once we leave, because while it's nice that we have this training, we're two people, so it'd be nice if more people knew how to do it. So I think that's been kind of something I wasn't expecting at the beginning, but I think something that's been really helpful.
I think it's been, in both of our job searches and where we're going to be going next year, the places we're going to have expressed a lot of interest in our knowledge of this, and that not that their providers currently are doing a bad job, but that everyone could use a lot more education on it. And I think that it's definitely like a unique thing that we are going to continue to teach people about in the future, I think, at our future practices too. So I think our day-to-day will always involve a certain amount of teaching and helping, people just be able to take better care of the community.